Hello, I am Dr. John Boyce, a cardiovascular physician at the Mayo Clinic in Rochester, Minnesota, who specializes in cardiovascular imaging, which includes nuclear cardiology, cardiovascular CT, and cardiovascular MRI. I also have the privilege to work alongside my colleagues in caring for patients in the cardiovascular sarcoidosis clinic here at Mayo. Today we are going to briefly discuss the role of magnetic resonance imaging, otherwise known as MRI, in the management of the patient with suspected or known cardiac sarcoidosis. Our objectives together are threefold. First, we will summarize what MRI is and how it works to make a picture of your heart. Second, we will discuss how a cardiac MRI may prove useful in the management of cardiac sarcoidosis. Third and finally, we will briefly review what you should expect on the day of your cardiac MRI. So let us start with the first objective, understanding how an MRI machine can make an image of your heart. To begin, remember that our body is composed of billions of small building blocks called atoms. One particular atom, hydrogen, which is a component of water, is found in abundance in our tissues. Hydrogen has a unique property known as a magnetic field, which causes it to spin in certain directions in our body. Our body is made up of billions of hydrogen atoms, all of which are spinning in random orientation. So for example, imagine that this blue pin is a hydrogen atom in one part of your heart. It spins along its axis, just as the Earth spins along its axis. This black pin is another hydrogen atom in your body in another portion of your heart. It also spins along its axis, but it spins in a different orientation or different direction. And all billions of these atoms in our body are spinning in a random orientation. So how does all this help us to make a picture of your heart? If you recall, an MRI machine is a powerful magnet. In fact, it creates a magnetic field 20,000 times that of an Earth's magnetic field. So once you are positioned within an MRI scanner, your hydrogen atoms will experience this magnetic force and they will all line up in orientation with it. So again, remember, you have all of these hydrogen atoms spinning in different orientations in your body. When you go within that magnetic scanner, they all line up in a row. That's the first step. The second step occurs when we transmit radio frequency waves, similar to a radio signal. These waves will momentarily cause the hydrogen atoms to reverse their alignment. The radio frequency wave is then turned off, and all the atoms realign with a magnetic field. So for example, these are your hydrogen atoms again spinning within inside your heart. They're all lined up in the same orientation with the magnetic field. We pulse a radio frequency wave into your body. They flip their orientation. We turn that radio frequency wave off, and they slowly reorient again with a magnetic field. The time it takes for the atoms to do this, to reorient with the magnetic field, is determined by what tissue they are. For example, fat, muscle, or fluid. It really is like a fingerprint identifier for each tissue. The image we make is based off the time it takes for those atoms to recover their magnetization after the radio frequency pulse. So now if you have inflammation or scar in your heart, that will affect how the tissue is able to recover its orientation with the magnet after we have administered the radiofrequency pulse. And therefore the picture will look different. How will it look different? Well, that leads us to our next segment, how MRI helps us with the diagnosis of cardiac sarcoidosis. Now, MRI allows us to make a detailed assessment of the heart. For patients with cardiac sarcoidosis, it is critical that we assess if there's inflammation or scar within the heart. Recall that if there is an abnormality, such as scar or inflammation present, the time it takes for the tissue to reorient itself with a magnetic field will change. A very common means by which we look at inflammation in the heart with MRI is to inject gadolinium contrast. This is much different than the contrast that you might have heard of with CT, and allergic reactions to gadolinium are quite rare. Now, gadolinium is unique in that it has paramagnetic property. What does that mean? It means that it affects the magnetic behavior of tissues around it. In a heart without any scar or inflammation, when we inject gadolinium, it washes into the heart through blood vessels and then rapidly leaves the heart through blood vessels, so that by the time we take a picture with our MRI machine, we don't see any gadolinium. However, if a patient has scar or inflammation in the heart, that gadolinium is not washed out right away, but lingers and is actually stuck in this tissue for a bit of time. And when this occurs, it allows us to see the gadolinium on our MRI scan. And we can not only locate the inflammation, but we can also measure the extent of it. So let's look at an example together of a region of sarcoidosis or inflammation/scar in a patient who underwent a cardiac MRI. As you see here in this example, you have the heart. The blue arrow is pointing to black part of the heart, and that is normal heart. The red arrow is pointing to bright or white part of the heart, and that's because there's gadolinium stuck in that tissue. This is where inflammation or scar is occurring in this patient. By identifying this area of abnormality, cardiac MRI can help us with the diagnosis of cardiac sarcoidosis, but it also can potentially help you and your physician with assessing your prognosis, as well as determining therapeutic interventions. For example, what medications to give and how long to give them. Let's transition to our final objective together, which is to review what you should expect as a patient undergoing a cardiovascular MRI here at Mayo Clinic. Prior to the procedure, you should continue all medications unless specifically instructed by your physician otherwise. When you check in, you will be asked to change into a gown and remove material that might affect the magnetic imaging, such as watches, glasses, or jewelry. An IV or intravenous line will be placed. During the test, you will lie down on a movable table that will enter a long, narrow tube which is open on both ends. This is the MRI machine. If you have fear of enclosed spaces, claustrophobia, a medication can be given to help you relax. The examination itself will be painless, and there are no moving parts to the machine. However, you will hear repetitive tapping and thumping noises which occur when MRI is making images of your heart. You can be provided with earplugs or music to help block this noise. You will also be in radio contact with the MRI technician at all times during the test in case you have questions. During the test, we ask that you hold still, as this will help create the best images. At times, you will also be asked to hold your breath. Near the end of the examination, the gadolinium contrast agent that we spoke of earlier will be administered through your IV line. You might feel some warmth at this time. Of note, if you have a cardiac device, such as a pacemaker or an internal cardiac defibrillator, extra precaution will be undertaken during your test. This is because these devices can interact with the magnetic field and potentially damage both the device and tissue surrounding the device. A cardiac radiologist will review the specific risk of an MRI test in patients with a cardiac device prior to the examination. A device nurse and an MRI physicist will be present throughout your examination, if you have an intracardiac device, in order to closely monitor for any abnormalities that might indicate an interaction between your device and the MRI scanner, and they may terminate the test if this occurs. Of note, we've performed over 2,000 MRIs in patients with intracardiac devices and have not had any serious side effects. So let's summarize together the 3 key objectives that we discussed today. First, we discussed how does an MRI work to make an image of your heart. Recall we discussed that you have different atoms in your body, and one specific atom, hydrogen, has a magnetic property that allows it to rotate around its axis, just as the Earth rotates around its axis. Now, the billions of hydrogen atoms that you have in your body typically are oriented random and spinning in their own direction. However, when you go in an MRI scanner, they all line up together with that strong magnetic field. We then provide a radiofrequency pulse which changes the direction these atoms are rotating. Once that radiofrequency pulse is turned off, the atoms slowly reorient with a magnetic field. The time it takes for that reorientation helps us to make a picture of your heart. If you have inflammation or scar in your heart, the time it takes to reorient with the magnetic field will change. We also discussed how cardiac MRI can be useful in the assessment of patients with cardiac sarcoidosis. Recall that we give gadolinium. This is an agent that has paramagnetic properties. That means it changes the magnetic field of tissues around it. And if a patient has scar or inflammation, the gadolinium gets stuck in the tissue in the heart for a certain amount of time, and that helps us to take a picture of the heart to show where that gadolinium is. You might recall we showed that image of the heart where one part of the heart was black, that was normal tissue, all of the gadolinium had been washed out, and one part of the heart was very bright. That's where scar and inflammation was occurring, and the gadolinium was stuck in there and was slowly coming out. Third and finally, we discussed what you should expect on the day of your tests, beginning with medications, transitioning to gowning, then discussing what you might experience during the MRI scan, and we specifically noted the precautions we take in patients who have intracardiac devices. Thank you so much for your time today.